This is an exciting time for you.
It really is. A lot of extraordinary things are happening, especially in the field of occupational therapy. More and more people are starting to be aware of what the profession entails.
Okay. So can you tell me about occupational therapy?
Yeah. Well, the word occupation means everything we do on a daily basis. So that means, dressing yourself, washing your body, driving your car, even the roles we play within our own environment with our families. Maybe you cook for your family, maybe you take a youngster to school, but occupational therapy expands on the word occupation in terms of what we do on a daily basis.
Okay.
And then the therapy part is the rehabilitation part of it.
Okay. So can you tell me how you got into occupational therapy?
Well, it's a long story, but I'll make it really brief. I've always wanted to be a doctor. I remember being in high school and elementary school, and I wanted to be a medical doctor. But I kind of took a beeline towards being studying technology. So my bachelor's is in information systems. So I was a part of corporate America for at least 15 years before becoming an occupational therapist.
Okay. So how long have you been into occupational therapy?
Over 10 years I've been studying, and then before that I had to, of course, take tons of science classes. I had to embrace science, so I had to take tons of prereqs just to catch up before becoming or studying the field of occupational therapy.
Okay. Can you tell me what you like most about it?
Yeah. There's so many wonderful things about OT. The best thing is that I meet extraordinary people. People who suffer from TBIs, which means traumatic brain injuries, to neurological disorders such as multiple sclerosis, Parkinson's, people who have strokes, diabetes, and a lot of those diagnoses can be quite debilitating. So it can change your life in a split second. So there's a lot of depression that goes along with getting a diagnosis such as those. And I do, I pray with my patients. I try to help them not fall into depression. So my job is pretty extensive because I deal with the emotional component of being an occupational therapist as well.
Okay, so is there a particular part of the body that you treat?
Good question. So it depends on the setting. When you work within a hospital setting or a home health setting, occupational therapists, they focus on the upper body. So they're responsible for injuries or post-surgeries that deal with upper body issues such as the shoulder, the elbow, wrist, the digits, the fingers. So anything related to the upper body, I specialize in.
So we know cancer is big in our community.
It is.
Can you talk a little bit about that or some of the specialties that you have?
Okay, good question. I'm lymphedema certified, and the reason why I chose to get lymphedema certified is because I have family and friends who experience breast cancer, and a couple of them I've gone through the process of going to their chemo treatments with them, their doctor appointments with them, and I've seen the hard decisions that they have to make.
Yes.
And they have to make them ASAP. So I know what they go through mentally, physically, and it was heartbreaking to me. So I wanted to do something to help them. So I became lymphedema certified. Which helps with that swelling that generally will come after lymph nodes are removed. Yeah.
All right. We don't want to take up too much of your time, so we just thank you for giving us this interview, and we appreciate you.
Thank you.